Hello and welcome. Thank you for joining us for this recording of our web-based workshop series developed by the Direct Care Workforce Strategy Center and made possible through support from the Administration for Community Living. This Direct Care Workforce Strategy Center web-based workshop series brings together state teams, national partners, and subject matter experts to share practical strategies, tools, and approaches for strengthening the direct care workforce. Each session distills lessons learned, evidence-based strategies, and emerging practices from the field to support states and stakeholders in advancing systems change efforts. Before we begin, here are a few quick notes about today's recording. All viewers will see an ASL interpreter on screen. To access captions, press the closed captions or CC button on the video. Where possible, if a particular resource or data set is mentioned, a link is included below. If you experience any technical issues when accessing this video, please reach out to directcareworkforce@ncoa.org. Thank you again for joining us. Let's get started.
And if you're not familiar with PHI, we are a national organization dedicated to improving job quality for direct care workers as the foundation of quality care for older adults and people with disabilities. PHI is proud to be one of the national partners supporting the Strategy Center, along with the Institute on Community Integration at the University of Minnesota, who is co-leading this workshop series, and other awesome partners. As we move into the session, I would love for you all to take a moment to share in the chat your own names and organizations and where you're joining from. But also, in addition, today, last time you told us where you're located. We'd love to hear that again, but this time, please share also where you wish you were joining us from. Would you like to be joining us from a hammock at the beach in the summertime, or the side of a snowy mountain, or maybe just your sofa at home? I will share that today is a fairly cool, rainy day here in North Carolina, and I happen to really enjoy cool, rainy days. So if I had my druthers, I would be somewhere out in good waterproof gear, striding across a moor while I was talking to you all about evaluation. So on the next slide, please, we have 90 minutes together today, and here's the plan for our time. We will hear in a moment from Nicole Howell, the director of the Strategy Center, and then I'll come back on to talk through 4 formative steps in evaluating workforce investments. And then we'll get to hear from Dr. Clare Luz from Michigan State University and the IMPART Alliance, who will share her state's approach to strengthening the direct care workforce and evaluating the impact of that approach. We will end today not with small group discussions, as in the previous sessions, but with a walkthrough of each of the tools that's been designed for and shared through this workforce series to inspire your thinking and next steps, followed by an open forum for questions and conversation. But first, over to you, Nicole. On the next slide, please.
Thank you, Kezia. We are excited to learn along with you today. May I have the next slide? My name is Nicole Howell. I'm the director of the Direct Care Workforce Strategy Center, and it was created to strengthen state systems and support the recruitment, development, and retention of the direct care workforce. Now, the center is funded by the Administration of Community Living and led by the National Council on Aging, where in addition to providing direct technical assistance to states, we develop tools, resources, and support all of you to facilitate peer learning and sharing and elevating promising practices that are ripe for elevation and broader adoption. Today's events marks the conclusion of our inaugural workshop series, a new component within our broader technical assistance portfolio. I want to take a moment and thank all of our partners and speakers who have come together over the last month to really offer amazing content that it will help so many states and stakeholders to improve not only their understanding of their data, their transparency, and to build systems for the future that will really help them to support the expansion of the direct care workforce. And I want to thank you to all of you, our participants. who've come with us over this last month of this journey and learned along with us. Whether you've joined us live or you're watching later on a recording, your candor and your willingness to learn alongside us is invaluable. As this is our first workshop series, we know that we are continually improving and strive to improve the experience for all of you. So we really appreciate your grace as we strengthen the work of the Strategy Center. And we encourage you to complete the survey at the end of today's workshop series. It truly does help us to build stronger content for all of you. And with that, I turn it back to our facilitator, Kezia.
Thank you very much, Nicole, and thank you all for your introductions in the chat. I was really enjoying getting a quick visual of where you all would like to be calling in from this morning or this afternoon or whatever time zone you're in. So today we're talking about evaluation, or how to turn your efforts plus the data that you have or collect into evidence, the evidence that's essential for making and sustaining the real improvements that you seek. But first, quickly on the next slide, to recap, we started this workshop series with PHI's Stephen McCall guiding us through the process of identifying and prioritizing workforce questions overall and data sources. And then ICI's Dr. Julie Bershadsky helped us think further about identifying and aligning data sources, as well as understanding the gaps. Each of those experts will talk through these steps again briefly later when summarizing the tools that you're taking away with you. But today, on the next slide, we're going to talk through key steps in designing an evaluation plan for a particular investment or initiative, including engaging partners, creating a logic model, crafting evaluation questions, and developing a measurement framework. And I will do my level best to do justice to this pretty ambitious amount of content in about the next 20 minutes. But first, let's take a moment to remind ourselves why we should evaluate our efforts, given the extra time and resources required to do so. Can't we just do the thing and move on? Well, here are some of the reasons why, in case maybe you need to school anyone else on why evaluation matters. So first of all, we need to evaluate in order to track implementation. Is the investment or initiative being implemented as planned? Are the funds and efforts being allocated as intended? Are the right partners involved? We can also use evaluation to assess progress. What is working so far and what's not? What barriers have been encountered and how have they been overcome or should be overcome? What mid-course corrections might be needed to achieve the aims that we seek? Evaluation is also, of course, critical to documenting impact. How effective is your investment or initiative? What outcomes have been achieved and who particularly has benefited and how? Evaluation is also important for informing decisions, particularly for making or promoting evidence-informed decisions about where to allocate resources. For example, through scale-up or replication, or for sustainability of a given program, or for pivoting and trying a new approach instead. And finally, evaluation is important for communicating success to key audiences in compelling ways that help build awareness, generate support, and encourage action. And on the next slide, I just wanted to acknowledge a couple of resources from the W.K. Kellogg Foundation that I have found really helpful in my own evaluation, learning, and efforts, and that have informed some of the content that I'm sharing here today. So I really encourage you to check out these resources, if only just for kind of thinking about how to embrace a kind of evaluative mindset with regards to your work. So where do we start? We start by engaging partners. On the next slide, we've already talked about engaging partners. It was the first step in the first session, but I wanted to repeat that step here because an evaluation may need additional or different input than a broader workforce-related effort. So the types of questions that partners can help specify and answer include questions like, what results are expected from this strategy, initiative, or program that we're planning? And relatedly, what will success look like? How will we know when we've achieved it? They can help think through what factors might help or hinder success, and also what potential benefits and harms of evaluation itself should be assessed. Partners can help think about who or what are the best data sources, and of course can help think about who else should be consulted on the evaluation plan and informed of the results. In other words, here on the slide are all the kinds of questions that you will be grappling with along your evaluation journey, and you want to make sure that you're tapping the best experts around you to help. And here on this slide is a structured and strategic way to think about partner engagement, because you want to tap all the relevant experts, but you don't necessarily need or want everybody to be in every meeting. And in fact, nobody wants that. So here's what you can do. You can think about identifying all the potential partners or interested parties that may inform your evaluation effort in that first column. That's where you list all the different types of experts that you may want to engage. And then for each of them, you can think about the best mode of engagement. Do you want to reach out through listening sessions or engage folks in advisory groups or work groups, or actually have them on the evaluation project team, or consult them occasionally as subject matter experts, or some other mode of engagement? You can also think about what costs and other considerations may be involved in engaging one type of expert versus another. Really importantly, you can think through what role each partner should play through that relevant mode of engagement. So are your interested parties, your experts, your partners helping to answer those big questions about what will success look like and what benefits and harms should be considered? Or are they directly helping to design and implement your evaluation? Or are they helping to locate data sets or communicating the findings or other roles? So this is about not just who you want to engage, but how you want to engage them. And finally, you can set goals around how often you might want to engage a particular expert, maybe once or twice at key junctures in the project, or on a more regular cadence, or only at the beginning, or only at the end. So as you work through this table, you can kind of refine in your mind your stakeholder engagement or your partner engagement approach. And then, with all the right people on board, you can consider creating a logic model to describe and guide your efforts. If we were in a room together, I would really love to hear how many of you have used logic models in your work, or how many of you have heard about them, or maybe never heard of them. But I can't see enough of you to be able to. Oh yeah, let's have a quick thumbs up. If you have worked with a logic model in your work so far, can you hit the thumbs up button on your Teams? I see a couple. Okay. Oh yeah. All right. On the other end of the spectrum, is there anyone who has never worked with a logic model? Oh, maybe these are still logic model folks. Anybody who never has? Okay, so we have a pretty logic model savvy crowd here, so you can correct me as I go if there are ways that you think of a logic model differently. But here's a proposed definition for a logic model. A logic model is a systematic visual way. Sorry, I just see Dr. Bershadsky, you have your hand up, or are you just showing your expertise? Okay, just checking. A logic model can be defined as a systematic visual way to articulate how and why a specific strategy, investment, or program will achieve a set of desired results. So in other words, the logic model is a way to formalize and visualize your thinking about what you're trying to achieve and how you're going to get there. Logic models can be used in different ways at different points in your journey. So you can use a logic model to design a strategy, initiative, or program at the outset. You can use a logic model to inform implementation of that effort. So you kind of know what you want to do, but how are you going to get there? You can use it to develop evaluation questions and an evaluation plan. And that's really where we're focusing today. But you can also use it to organize content for reporting out on your evaluation. It can kind of give a framework for reporting your findings. And you can use a logic to improve a strategy or program over time. So on the next slide, here are the components of a logic model. I do want to acknowledge that there are a lot of variations of logic models out there. So you can use this version, you can use another version, but generally the components include first some kind of problem statement. What problem does this strategy, investment, or program seek to solve? And then you have a goal, which is the overall aim or intended impact of the effort. Essentially, the goal is the resolution of the problem that you've articulated. And then you have the core of the logic model. That includes your rationale and assumptions. So your rationale is your reasoning for why you think the effort that you're laying out here will produce the results that you seek. The assumptions are the factors that are necessary for success that are already in place, the pieces that you're already relying on as you build out your approach. Then the inputs and resources are the budget, the staffing, the infrastructure, the materials, etc., that will be dedicated to this effort. The activities are the actions that you will take to achieve the results that you desire, the results that you seek. And the outputs are the tangible, direct products of the activities. So what will you do and what will you generate or produce? Then the outcomes are the changes that you expect to see through those activities and outputs. And they're often further differentiated into short-term outcomes, intermediate outcomes, and long-term outcomes. And all of that feeds back into achieving your overall goal. And then you have the context and external factors, and it's worth trying to capture those as well. Those are the things that you know in advance will influence your results, or that emerge or come to your awareness over time. Because you can adapt or update the logic model over time to reflect your evolving understanding or approach. So the context and the external factors is kind of helping to understand where you're starting and what might influence your efforts along the way. So what kinds of things might we expect to see in a logic model about a direct care workforce strategy or program? Here on the slide, if you just click through, please, the problem statement might be something to do with recruitment or retention challenges or training gaps. The goal might be improved job quality, workforce stability, service quality, system capacity. Those are pretty high level. You'll want to be more specific than that in your actual logic model. Then the rationale, again, is sort of your hypothesis. Here's why we're taking this approach. Here's what we think is going to happen. Your assumptions are things like workforce is currently a priority for our administration, and it will stay a priority for the next 1 to 2 years, whatever the life of the project is, or funds will be appropriated as we expect them to be. Assumptions like that. Your inputs and resources, again, those are things like funding and staff, partnerships, data systems in place. And your activities are the things that you plan to do to get to your results. So maybe it's a wage enhancement policy, or a training or career pathways or coaching program. The outputs are what was accomplished or delivered and who was reached through those activities. And the outcomes, again, are the things that you hope to see change: higher wages, improved recruitment or retention, develop skills, new career pathway programs being utilized. Okay, that was probably the quickest run through of a logic model that that we could have done, but let's move on to the third step to talk briefly about how to craft specific evaluation questions using your logic model. So as I said a moment ago, you can use your logic model to determine what you want to learn through your evaluation. So if you're primarily at this point interested in whether and how a particular effort is happening, is it getting done in order to assess progress and course correct as needed, then you'll focus your evaluation questions on the first part of the logic model and conduct a formative or process evaluation. If instead you're ready to assess whether your efforts led to the results that you were seeking, then you're looking also or instead at the outputs and outcomes through a summative or impact evaluation. So just to say a little bit more about those two types of evaluation on the next slide, formative evaluations are more about improving. They may also be known as process evaluation. And I'm going to throw a few different terms in here, and certainly there are nuance between these terms, but these are sort of just broad brush distinctions. So formative or process evaluations focus primarily on program activities and outputs, maybe also short-term outcomes. So again, that first part of your logic model. They can help ensure accountability. In other words, make sure that resources are being managed well and used as intended. Formative or process evaluations allow for monitoring and timely reporting on progress toward goals, kind of real-time reporting out versus looking back over the life of a project. And they can help identify challenges and barriers and inform mid-course corrections. Summative evaluations, on the other hand, are more about proving the case. They may also be known as outcome or impact evaluations, and they're focused primarily on results. In other words, the outcomes part of your logic model. They allow you to assess whether the initiative worked, and also to determine whether it's sustainable and whether it should be replicated or scaled up. And summative evaluations or impact evaluations also support effective communication about the initiative. That's the kind of evidence you need to be able to tell the story of this important project or policy or initiative and how it achieved the results that we were looking for. So then breaking it out a little further, I wanted to talk through a few domains from across the logic model that you may want to address through your evaluation questions. I'm going to repeat myself in the first couple of columns here, but just to kind of reinforce some of the primary types of questions you might want to ask. First of all, there are the process questions. So was the effort implemented on schedule and as intended? Why or why not? What factors helped or hindered success of implementation? And what lessons were learned along the way? And then there are the impact questions, like to what extent did the effort lead to the anticipated results? What changes occurred? And to what extent did this effort contribute to those changes? But also what might have been the unintended benefits and or unintended consequences? Then relatedly, but also somewhat distinctly, there are investment-specific questions. So was the effort cost-effective? What was the return on investment of this particular project or initiative? And what alternative approaches may have represented better investment and outcomes? On the next slide, you have context questions like what demographic, economic, social, political, and other factors may have influenced implementation and outcomes. Also, what internal factors may have affected the effort, like changes in staffing or budgeting or priorities. If you're going to want to speak to the context in your evaluation, it's important to set these questions in advance because you may want to implement some kind of documentation process through the project versus looking back at the end and trying to remember what happened contextually that may have impacted your success. Then you have overall strategy questions. So was the logic model that you designed in advance correct, appropriate, helpful? Did what you envisioned as the logical progression of inputs to activities to outputs and outcomes pan out? And if not, what part of the logic fell apart? What new logical pathways may need to be explored instead? And then the most global set of questions is about next steps. So looking at the totality, the full set of activities and outcomes, where do we go from here? What continued investment or oversight might be needed to sustain this effort? Can it be scaled up or replicated? Should it be? And why or why not? So those are the types of questions across different domains of your logic model that you can consider. So on the next slide, you have your logic model, you craft those evaluation questions, and then it's important to review and refine them. You can consider questions like, have a variety of audiences been considered when crafting the questions? Have the highest priority questions been selected? Will each question generate useful, actionable insight? Is it clear how each question relates to the logic model? Are the questions specific about what kind of information is needed? And do the questions capture lessons learned along the way? Because even if you're primarily focused on outcomes, you want to be prepared to speak to how you got there and what you learned in the process, because that's so important for telling the story and for focusing on replication or scale up and sustainability. So these are the kind of questions that you can apply to your evaluation question set in order to make sure that you have the most important, well prioritized, well specified questions to guide the way forward. And then the final step that we'll touch on today and really just signpost toward is developing a measurement framework. When you get to this step, you will be pulling in all of that good work that you've already done related to defining the workforce and operationalizing your key concepts and identifying and assessing and aligning your data sources and addressing data gaps. All of the content that we've covered through these sessions kind of all comes together here in the measurement framework, which is why I wanted to quickly touch on it, even if not getting into too much detail. So your measurement framework is your blueprint or your roadmap for pulling together or collecting the data that will help answer the evaluation questions that you crafted from your logic model. So here are the components, and then I'll talk through a visual example in a moment. First, you have your outputs and outcomes. Those are the specific outputs and or changes that are expected, and they're pulled in directly from your logic model. So that's maybe the easiest part of the measurement framework. Then you have in the next column, if you imagine this, and I'll show you in a moment in a table, the next column are your indicators. Those are the specific markers indicating achievement of or progress toward those outputs and outcomes. Then you have the measures of change, which are the actual value for assessing progress. So the indicator is the type of change and the measure of change is the actual change that you're looking for. Then you have the data source, which is specifying where the data will be collected or obtained, and data frequency, meaning how often the data will be collected or obtained. So on the next slide is a highly oversimplified example to bring the measurement framework to life. So imagine that we had a problem statement along the lines of non-competitive wages are driving turnover in the direct care workforce. That problem of workers are leaving because they can make $1 more down the street at Target. So the goal is improved workforce stability and continuity of care for consumers. Again, this is much too oversimplified. You'd want your problem statement and goal to be much more specific, but for illustrative purposes. The rationale then in the logic model for this example is that setting a wage floor for a group of eligible direct care workers above the minimum wage, the state minimum wage, would raise wages to a more competitive level, and that will reduce attrition. The activities are to get that wage policy defined and assigned and implemented. And then in the logic model, you specify the outputs and measurable outcomes from that policy. And that's where you start your measurement framework. And so here you may say that you may pull in an output, which is that the wage policy has been implemented. The activity is implement the wage policy. The output, it's implemented. The indicator is that wages have been adjusted to the wage floor as needed. And the measure of change is that wages for all eligible workers who were paid less than the wage floor have now been adjusted to the wage floor. The data source maybe is an employer attestation form that is collected annually. The outcome, the change that we're looking for, maybe, is improved earnings for eligible workers. What's an indicator of that? Maybe it's higher reported monthly income among eligible workers. The measure of change is the number of workers who report that their monthly income has gone up. And maybe we have to actually field a new survey in order to collect that data. So there's a workforce survey that goes out annually to test the impact or the outcome of this policy. So that is a whistle-stop tour of how you can prepare to evaluate and therefore document and communicate the success of your hard-won workforce initiative. And now I am so happy to pass the mic to Dr. Clare Luz, who I would say is one of the most knowledgeable and dedicated direct care workforce experts and advocates that you could hope to meet. She is also a gerontologist and associate professor in family and community medicine at MSU College of Osteopathic Medicine, and she's the founding director of the IMPART Alliance, a group that's dedicated to transforming Michigan's direct care workforce to meet growing needs. We are so lucky to have her here today to offer insights from Michigan's direct care workforce integrated strategies model. Clare, thank you for being here. Over to you.
Thank you, Kezia. Thank you. I'm humbled by that introduction. I appreciate it. And I am glad to be here with all of you. I'm glad to see several familiar names of people I've met in other sessions. I think that this cross-state pollination is not only important, it's really necessary. So I'm going to be talking about the Michigan experience. What we've learned is we've pursued competency guidelines, training programs, credentials, a registry, and much more for direct care workers, and the business case for all of this. So when Kezia first contacted me, she asked me to talk about how we've been evaluating all of our programs and why. And the short answer is we evaluate all of them every which way possible, and we've had to do it very methodically, follow the evaluation steps that you're hearing about today. And it's been especially important because in Michigan, our case really is quite complex. We have multiple programs. Our biggest grant alone has 42 deliverables, including 25 mini grantees that we've issued grants to, each with their own programs, each with their own evaluation metrics. And in addition, one of our deliverables is to establish a direct care and caregiving center for the state of Michigan, so the infrastructure for a whole new organization. And a critical component of any organization's infrastructure is, or it should be focused on, data structures, a system to manage all of the data, including program evaluation data. So I'll spend a little bit of time talking about the range of ways in which we are evaluating program, process, and impact, but not a lot of time because we've essentially done precisely what Kezia has just described. So I taught research methods for 10 years, and I really can't improve on her presentation just now. So I will instead, I think, talk a little bit more about why evaluation is so important and the need to pay attention to your data systems, the resources that you have in place to conduct evaluation, When I put a grant proposal together, one of the biggest budget lines is personnel, but I've learned over the years not to change the evaluation budget line. It really is a critical investment. First, I do think a little bit of background information about Michigan is important because everything IMPART Alliance does, everything we are doing at the state level through the Michigan Department of Health and Human Services Direct Care Workforce Advisory Committee, which I chair, is driven by a conceptual model that we began using and developing years ago that I refer to as the Integrated Strategies Model or Framework. Slide, please. And you'll hear that a lot of the language I use follows what Kezia was talking about in terms of a logic model. And it started with the idea that there are three major buckets of strategies or activities in a logic model being used across the U.S. To address the workforce shortage, the direct care worker shortage. And over time, I've become convinced that an integrated approach, one that integrates all of these approaches simultaneously, is going to be the most effective and impactful. And I began to develop an idea of an integrated strategies model. We have the problem, there's the direct care worker recruitment and retention challenges. Please note at the top of this slide is our main goal, which we believe this is really where we need to get in order to meet the challenges of the direct care worker shortage: economic security, job quality, and respect for all direct care workers. And the three buckets are increased wages and benefits. That's kind of a no-brainer. The second one is to professionalize this workforce. And by that, I mean establishing some competency, professional, ethical guidelines, training guidelines, and making training accessible and affordable, some competency-based credentials, career pathways, and success models. And then the third one, sociocultural change, increasing the value placed on direct care work. I really don't think we're going to get too far, even if we succeed in all of these other strategies, if we don't address a root problem of not placing enough value on direct care workers or caregivers in general, for that matter, or the people that they provide support and services to, the older adults and the people and individuals with disabilities. So the social and cultural change is imperative. And then just take a quick look at the bottom statement. These are some of the key strategies or levers that we use to affect change: the coordinated advocacy for systems changes and policy reforms. Research and evaluation is critical, and then a statewide awareness campaign to address culture change. So we've learned important lessons over the last few years about what is necessary to manifest this model. We learned in part through critical desk research what is happening in other states, what's working, what's not working, where are the gaps. We discerned this in part through literature reviews, interviews with leaders in other states, continuous listening sessions, inclusive discussions within our own group, and then adjustments depending on their feedback. And out of this, we've learned that the integrated model, to be successful, really needs to be embedded in a supportive environment that has specific conditions that make adoption and growth possible, including statewide coordinated leadership, shared language, shared goals, and some other principles. And this basically is the context or external factors that Kezia mentioned that influence your outcomes, the success of your outcomes. So just to give one example, we learned early on that we needed a shared definition of what we mean when we say direct care worker. And I know you all are aware of this, that direct care workers go by many, many, many names. And there's no common definition of what a direct care worker does. And we thought, our very first meeting at the Direct Care Workforce Advisory Committee, everybody was speaking a different language. And it took us 2 years to come up with a definition because it was really important that everyone in the room could see their own constituency in this definition, which required multiple iterations, each one taken back to the group for approval and more wordsmithing. And I think of this as following standard continuous quality improvement guidelines. And we did eventually come to a consensus on a definition that the full committee endorsed. As a result of this, the advisory committee has been able to make important decisions and progress together. Another example, we realized one of our first goals was to establish direct care worker competency standards, which in Michigan did not exist. And it's impossible really to establish training standards or credentials if we don't even know what competencies we're training people to. So another 2+ years to reach consensus on 15 competency standards that have since been adopted by the state. It is one of our success stories in terms of outcomes and impact. And there are many other examples. But again, all of this was made possible in part because of the integrated model driving everything, and because we were conducting the QI process and impact evaluation and research at every step. So Kezia did a really great job earlier of outlining why both formative and summative evaluation is important for assessing progress, documenting impact, informing decisions, and has certainly made all the lessons learned in Michigan and our progress possible. It's taken many forms. The following visual is just, I'll quickly reference that slide, please, is visual. Well, I already talked about sort of these 3 groups of strategies, 3 elements conducive to success, and 3 key levers that we used. And if you look at the group of strategies, really that sweet spot is in the middle where all of those strategies come together, and because they're inextricably linked. And I'm not going to go into a lot more detail on this because I just described a lot of it, but back to the necessary step in research evaluation of engaging partners. It's one of the very first steps, right? To engage partners, to determine what are the program needs, what are the gaps, what are the questions that everybody wants answered, which in turn will drive the data needed. What data do you need to answer those questions, and discussion around data sources. So let me take just a few minutes to talk a little bit more about the advisory committee, because this is the group, the central group engaged in these discussions. So how did it come about and how has it evolved? How do you engage partners? Slide, please. So this is the group that initially asked a lot of questions that drove decisions. What results or outcomes do we want? Did we want? What would success look like? How is it going to be measured? What's doable? What are the challenges we will face? What's going to help us successfully reach our goals? What assumptions are we making? So think back to the integrated model and the context, the environmental conditions we felt we needed in order to move forward, and the need for the shared language, and a commitment to really raising up all direct care workers simultaneously. What's already in place? We didn't want to be redundant, and on and on. So Kezia already mentioned many of these questions. So who was involved? It was really important to us to be as inclusive as possible. And we wanted to include representatives from all settings, all stakeholders, all populations served, all payer sources, all programs, just about everybody. And as you can imagine, this takes time and patience to develop relationships across all of these different sectors, making sure that everybody feels respected and heard. Everybody sees themselves in the language, the goals, the strategies being used and evaluated, all of the decisions being made, and continuous sort of a readjusting to make sure people were not feeling left out. It's really not for the faint of heart, and it's not for people who want immediate results. It's a really long road we're on. But having said this, we also recognize the need for immediate action, the short-term goals for getting more direct care workers, qualified direct care workers, into the workforce as soon as possible, because the shortage is, the need is yesterday, right? So everybody's feeling of the pain of the shortage. So it's this constant dance between the short and the long-term goals. The logistics, we meet monthly. I will have to say the impact of COVID, actually, there was a silver lining. We had one meeting early in March of 2020, and immediately after that meeting, COVID hit and everything shut down and we had to switch to virtual. So that actually worked in our favor. We had people at the first meeting from all over the state of Michigan, including the Upper Peninsula. Michigan's a big state, like many of yours, like Idaho, and others on the call. But we had people there who could continue to come because we had to switch to virtual. And everybody keeps coming back. We've actually been meeting monthly for 6 years now. And every meeting I sit there in awe and I think, wow, you came back. You're here again. And it's great. And the question, it begs the question, why? Why do they keep coming back? What keeps them engaged? And I really believe there are a number of reasons. We've been able to keep everyone together for several reasons. One is there's a neutral convener, and that's us, IMPART Alliance. So we coordinate all of this, but we work really closely with a key person within the Department of Health and Human Services, and that relationship is crucial to have both the internal and the external partnership. We do have the virtual meetings. We are inclusive. We try to make sure everybody feels respect. And there's such a critical need. Everybody's feeling the pain. And it's gotten to kind of a desperate into a desperate territory, and it's going to get more dire with the projected cuts to Medicaid, for example, and the budget problems we're having. So I think the group keeps coming back because they see visible progress, positive impact being made, and they will tell you that the successes are what's keeping them going, and it's instilling hope. And some people have said, we feel hope. We don't feel alone anymore. We feel like we're in this together and we're seeing progress that gives us hope. So I mentioned that we knew that one of the first things we had to do was to define the workforce itself and develop common language. So here's what we came up with. Next slide, please. This is the definition. I'm hoping you're all going to get a copy of this PowerPoint, so I don't need to go through it now. You can read it. You will see it's very, very inclusive. Some people will say it's too inclusive, and I will say that the state of Michigan is not using this definition for a lot of reasons, but our group does. And we are the advisory committee to the Department of Health and Human Services, and they recognize this definition. So one of the reasons to conduct evaluation is to be able to communicate with decision makers. What is the impact of reaching consensus on this definition? Really big impact. It gives us the ability to go to the legislators with common language and common consistent messages, and to do otherwise is really counterproductive. To have a number of people, many, many different groups and people coming to even the same legislators using different language, different terminology, asking for slightly different things. It's confusing. They get confused. And having common language and common consistent messages really helps everybody's cause. And it helps us to avoid being counterproductive and undermining each other's efforts. So another important reason for evaluation is to be able to communicate success, as Kezia said. So to make valid and defensible arguments for the change you seek. And this is especially important for increasing your visibility and culture change, and for funding and other reasons. So what has everything we have just discussed allowed us to do? And more importantly, what has the impact been? So next slide, just a few of the objectives we've had and the outcomes that we've been able to achieve, leveraging for additional support, primarily because we could provide evidence of impact. So after months of analyzing all kinds of data, we landed on a simple maxim in terms of professionalization of direct care workers. And that is, we just simply, it got so complicated, and we finally just brought it back to a fundamental desire. And that is to make sure that people have the competencies they need that are relevant to the job they are being asked to do. And going back to that maxim, we came up with 4 new direct care worker categories with associated competencies and credentials, and they are under consideration by the state of Michigan right now. So a major long-term goal was to establish credentials associated with these competency levels, and that will be recognized by all payers, all programs across all settings and populations for maximum portability and reciprocity and continuity of care and quality of care and administrative efficiencies and cost containment. So these were some of the goals we are after, and it will provide increased ability to move direct care workers across boundaries. So we contracted with a national company called Corporation for a Skilled Workforce to help with this, and the goal is very much in progress. There's something about 2 years. We've got this 2-year thing going. Again, a 2-year very intense process with 7 to 8 phases. We are in phase 8, evaluation every step of the way to come up with credentials for non-credentialed direct care workers right now. Most are non-credentialed. So following the steps of evaluation and continuous QI was crucial in developing the exams upon which these credentials are going to be conferred, because these exams must be legally defensible. So crucial that we follow all of the rules of good evaluation. Another major goal has been to establish the Direct Care Career Center or Caregiving Center that I mentioned earlier, which we've done. I'm going to quit saying we have to establish it because it exists now. So, some of the time when you're doing evaluation, your metric is going to be it didn't exist and now it does. So, and this does exist now, which I'm truly excited about. And the funding that we've been getting has made this possible because of documented progress toward all goals over the years. In fact, one of the impacts of demonstrating progress has been how it has positioned us for major funding. So the next couple slides quickly catalog just a few successes and the funding received to build on these successes. Slide, please. I've already talked about some of these. We established 15 statewide direct care worker competency guidelines. We have common definition of direct care workers. We have indeed helped to secure wage increases. Governor just passed a budget a couple of weeks ago. Those wage increases have been maintained, which I'm so happy about. I know a lot of states had wage increases during COVID and then they were retracted. So happy to say that they are still in our general budget. And then we have developed 15 key policy recommendations, also adopted by the Director of the Health and Human Services. So more success. Next slide. So I already kind of talked about the first bullet. I said we're creating 4 new categories of direct care workers. These will not replace any of the other categories. I will say that they were designed intentionally to increase opportunities, increase access to other additional career paths to supplement the current categories that are already out there. But the intent here was partly to be able to move direct care workers, train direct care workers into the workforce as quickly as possible. So we asked the research question, what are the most basic fundamental competencies that every direct care worker should have before they go see anybody? And that is what we cover in the direct care fundamentals class. And the idea is that they can at least get those fundamentals and get out working safely, providing some quality services to people. And if they want to go on and achieve some of these other levels, they can do that. But at least they're out there in the workforce helping. Because of all of the work, we have received some major grants. The $2.8 million was awarded to IMPART Alliance through the 2023 General Fund to establish a training and credentialing infrastructure, which I've talked a little bit about. And then a couple of years ago, we got this $25 million using American Rescue Plan Act Home and Community-Based Services Spending Plan funds to provide grants to employers and providers to support innovative recruitment and retention strategies, and to establish this direct care career center that I've mentioned. So this, I call it the DC3 for short, and the DC3 now exists. And it includes two really important components that are relative, I think, to this discussion. And one is a complete data structure and several data systems. Now, again, we hired a Corporation for a Skilled Workforce, and they in turn hired a national company called Dreamcatch, who helped us build this data structure. Again, 2-year process to put all of this in place. And I was a little late coming onto this meeting because I was leaving our last Dreamcatch meeting after 2 years. That structure's built, and they are now turning it over to MSU. That's what they were doing during the meeting, was turning everything over to MSU where this structure will be housed. It's going to store all of the workforce data that we are collecting. It's going to allow us to manage, access, analyze it, generate reports for the state, have a dashboard with really important information for employers and direct care workers and others. It's going to give researchers access to it to conduct primary research and to continue answering all of these research questions we all have. Our final meeting, as I said, was just prior to this one. It's now being transferred over to MSU by Saturday, I'm told. So the second big reason that our goal from the 25 million that relates to this discussion was that we did create a research and evaluation division, again, a critical investment to have the skills and resources needed to oversee evaluation of all of the programs, the data structure, and for conducting ongoing primary research. So the following is a visual of the DC3 structure. It's not our org structure. It's really, slide please. It's going to be really hard to read.
Claire, it's Kezia. This is amazing. And I wish we had more time. If you could sort of move toward your key takeaways, I think you're almost there, but just want to make sure we have enough time for some questions as well.
Absolutely.
Thank you.
Yep. And thanks for the reminder, Kezia. So this is the structure. And you'll get a copy of this, but it'll just walk you through everything I just talked about. Our goals for caregiving success services, credentials, training program, research and development, government relations and advocacy. These were our goals. And then in the boxes, you will see concrete things that have already been, our outcomes, our outputs that have already been developed, that are already in place, and that we are hoping to continue to build on. So last slide. These are some of the key takeaways, the value of the integrated strategies model in our view, the coordinated advocacy, the maximum public legislature awareness, the data that demonstrates impact, the formative summative evaluation that Kezia talked about, and the need for a data system and investment in an evaluation structure that supports your data collection and analysis. And right now, what our the big grant is ending next month. So we are now deeply involved in generating a financial sustainability plan and other sources of revenue to keep all of this going. So thank you. I'm going to stop right there. Thank you.
Wonderful. Thank you so very much. And just as with our expert speakers in each of the sessions, I wish we had another hour just to engage with the incredible content that you've shared and all of the questions that I'm sure are arising as a result. In reality, I think we'll just take maybe 1 or 2 questions now, and then we'll move on to our tool walkthrough, and then we'll have some additional time for questions for Claire or for the sort of pertaining to the content overall to close out our session. So any questions? Anyone want to raise a hand or just come off mute and pose a question to our expert?
And I'm happy for people to contact me at any time about any of this and to come back again for more.
Thank you, Claire. And we have contact information actually on a slide toward the end of the presentation. So she means it.
Yes, I do. I hope it was helpful, and I am happy to talk at any time. So please contact me.
And I'm seeing lots of affirmation with
Yes,
thumbs up and
thank you.
applause. Yes, and in the chat as well.
Thanks so much.
Any immediate questions? Okay, well, hearing none, I'm going to maximize our time together, but if as they come to you, we still got about half an hour, so you'll have a chance. So now we want to just take a few minutes to walk through each of the tools that we have shared through this workshop series, so that you have a clear sense in real time as we close out the series of the full collection of tools, and you can ask questions as needed. So again, please feel free to put your questions in the chat or even raise your hand as we're summarizing these tools, and then we'll have a bit of time at the end as well. The next slide is just a one-slide summary of all of the practical data and evaluation steps that these tools are designed to inspire and support. And that's what we're going to go through in turn. So first I'll pass over to Stephen McCall from PHI to talk through the components of the tool from session 1. And then Stephen, you can pass directly to Dr. Bershadsky to talk through the second tool, and I'll finish up.
Great, sounds good, Kezia.
Thank you.
Thank you all again for joining this workshop series. And just to recap what we covered in the first workshop, we really focused on those foundational steps around strengthening your workforce data systems, specifically prioritizing workforce questions and data sources. Similar to Kezia's presentation today, we broke that down into 4 steps, which are mirrored in the tool. The first is to identify and engage partners, as Kezia emphasized today. This is so important throughout the process of strengthening data systems and evaluation. So in the tool, we spend a bit of time making space for you to brainstorm with your teams, potential partners, and how their areas of expertise complement each other. And then for those partners, thinking about what might be some concerns those partners have and how might you shape a value proposition to recruit them to your cause so that they're not just a participant in your group, but a fellow data champion. The second step, as Claire emphasized today, is just defining the direct care workforce according to role, title, who employs the worker, and the related programs and payers. To really emphasize the breadth of roles and diversity of opportunities to strengthen workforce data in your state. And then moving into the third step, once you've gathered your partners and really gained a deep understanding of who the workforce is in your state, it's time to start thinking about data needs. Again, this is sort of evaluative thinking, getting started with what to prioritize in strengthening your data and evaluating your policies and programs. So in the tool itself, we provide some questions for you to think through and considerations for you to both develop priorities, thinking about what opportunities there are to strengthen data in your state, and then getting very specific about which segment of the workforce in what time frame and using what measures, again related to those outputs and outcomes that Kezia covered today, so that you can really develop a clear need to then work towards addressing. The tool also covers just some foundational thinking of where to start and which data sources to turn to, from the highest level using labor market data to the most proximal data sources for the workers themselves and their employers, so that you can sort of think through how these data sources might fit your needs. And with that, I'll turn it over to Dr. Bershadsky.
Hi, everyone. Dr. Bershadsky here. So the second workshop and the second workforce data planning tool really focused on aligning your data sources to the workforce questions that you previously sort of developed and understanding where the gaps are. The tool guided you through next steps for developing this approach, which really is understanding your data sources, aligning your data sources to your workforce questions, and understanding the gaps. The first step is to, as I keep saying, understanding your data sources. This really involves delving deeper into the data source, the potential data source, and then start documenting details about the data source along several domains and areas, starting with administrative details, which will contain things like who owns the data, who is the steward of the data, whether there is any statutory basis for it, primary purpose of data collection, which is also important to document. Then you'll also want to document and understand population and coverage of that data source as it relates to your to the workforce, which includes things like programs included, service settings, and workforce types included, geographic coverage, and whether it's sampling or population based. Also, you want to understand which workforce data elements are included. Things like workforce size, composition, stability, compensation and benefits, credential, demographic, worker experience. Data characteristics include things like the unit of analysis, collection frequency, most recent data available, what kind of data it is. You'll also want to understand data quality and limitations, the potential for linkage and integration, who currently can access and use the data, what the reporting burden of that data is. Once you document and understand those details, you can really start looking at aligning the data source to the workforce question. Next slide, please. To do that, you can sort of evaluate that data source in relation to your key workforce question against several dimensions. The dimensions that we're suggesting are coverage, content of the data source, data quality, timeliness. You can rate that data source, score it along those dimensions, assign total score. The higher the total score, the more aligned that data source is to your workforce questions. Then also for those areas, for those dimensions that score 0 or 1, you can start thinking about what information is missing and what the gaps are. And that is the next slide, please. You can start documenting those gaps again along those dimensions, and then you can start thinking about what is contributing to those gaps again along those same dimensions, and then which gaps and where they can be prioritized, thinking about prioritization based on the impact on your questions and also feasibility. What are the quick wins versus more longer term fixes that would require a larger investment. All right, I think that is back to Kezia for a quick recap of the last tool.
Great. Thank you, Julie and Stephen. And just to be crystal clear, in case anyone was wondering, why are you giving us slides with kind of fuzzy tables and questions on them? These tools have been produced as separate standalone documents, which have been shared by email and will be shared in sort of a more formal final form at the end of this workshop series. So these are just screen grabs to kind of remind you of what's in each of the tools, but you have a much better quality version at your fingertips. So just to quickly go through what we talked about today, today's tool covers 4 steps. First, there is a table to guide you through the process of identifying key partners to engage specifically in your evaluation efforts and think through how and when to engage them. Then the tool guides you through the steps to creating a logic model for a particular program or policy or initiative. Note that they are in order here. But you don't have to go necessarily from start to finish. You can actually start at the end and work backwards. You can start somewhere in the middle and work outwards. So you may have a real clear sense of your activity and you kind of build out your logic model around your activity. Or you have a sense of where you want to get to and you work backward from there. Or maybe you're just starting out from your problem statement and then you kind of logically map what you need to do to get to the resolution of that problem. So these can be undertaken in various different orders depending on where you are in the process. The third exercise in the tool walks through the process of crafting and then refining and prioritizing your evaluation questions using a set of overall evaluative criteria. So there's a table there that you can fill in with your yeses or your not yets for each of those criteria, plus any comments or changes that you choose to make. And of course, you can add your own criteria that are relevant to your own context to that table and to that refinement process if you wish. And then the final part of the tool points you in the direction of creating a measurement framework to structure your evaluation efforts based on those evaluation questions that you crafted and refined and the detailed outputs and outcomes that you specified in your logic model. So now we have come to the final question and answer part of the agenda. And I really want to encourage you all to, and I think in a moment I'll ask that we take down the slide so that we have a chance to see each other. I encourage you to ask any question that has come up in today's session or throughout the workshop series, or to provide, or for our speaker for today as well, for Dr. Luz, or any comments or feedback or experiences that you would like to share. This is our sort of closing chance to engage with each other around the content that's been raised in this series. And if you don't have a question or a comment, but you just want to share one aha moment that you had as you were participating in this series, or one action step that you're hoping to take forward from here, we would love to hear that too. So if we could stop sharing slides for a moment and just open up the space so that we can hopefully see everyone. And again, you can either raise your hand or you can just come off mute and jump in.
So I will jump off mute for you, Kezia.
Perfect.
I don't know if anyone else is in this realm, but I'm just in like information analysis mode right now, my brain. So it's hard to like come up with questions right now, except just to say this has been very helpful through these sessions. Kind of having this as a refresher in some places, as new moments in others, as ahas, especially today's. It was so thorough, and I liked the presenters pivot to talking more about just what this looked like as they went through the process, because you covered so much in your presentation portion. So just thank you everyone for the work you put into these, and I look forward to more webinars from this group in the future.
Thanks, Joe. Really appreciate that feedback, and glad you found a mix of kind of aha moments, new content, and also refresher and maybe some pulling together of the different elements of this work. That's really wonderful to hear. And I definitely hear the point that there's a lot to kind of sort through and ameliorate here. So questions may come up down the line. And I'm going to allow a little bit of awkward silence because I'm sure there's some questions there.
So this is Serena with the center, and I have a question for the speakers. What happens in a situation where your state that is dealing with budgetary issues. You don't maybe have the most robust data collection processes or platforms to work with, but you've got to start like somewhere. Like what kind of I guess visions of hope or advice do you guys have to really help encourage state leaders who might be feeling pretty overwhelmed right now, given their other fiscal pressures that they're facing? Like, where just can they use everything you've shared with them just to kind of get started?
Can I invite our state expert to speak to that first? Claire, would you like to take a crack at that and then we can follow up?
Sure. It's a great question. If I'm hearing you correctly, it's how do you get started when we're in this economic climate that we're in right now, and you have leaders, legislators who are nervous about the budget, and you yourself don't have a lot of resources. So we did not have a lot of resources for a lot of years either. I think what really changed everything for us was when at the time in 2020, the director of the Office of Services to the Aging reached out to me to start this Direct Care Workforce Advisory Committee. And we didn't have a lot of resources at that point in time either. We had has been around for about 10 years, but we didn't have the serious financing that we have right now. So just beginning to, just like we said earlier, Kezia said, and you have to start bringing people together and developing those relationships and making sure that it's inclusive and everybody feels respected, and that takes time. So I think that's part of my advice, is just to start bringing the key people together and find some common language, some common goals. You know what the problem is, and you have to come up with some shared goals, some shared language, some shared principles. Some of the principles we came up with were that we agreed we were going to lift up all direct care workers, not one group or another, for example. And we had the neutral convener, which helped a lot, because to bring all these people to the table, some of them, well, actually a lot of them are competitors and going after the same funds. And so finding that common ground is crucial. And then I do think thinking about evaluation from day one. I've been pulled into studies where the study's done and now they want me to evaluate the program. I'll go, well, wait a minute, what were the original questions? Yeah, that's the first step, is pull these people together, come up with shared language, shared goals, ask what are the key goals you want to achieve? What are the key questions that have to be answered? What kind of data do you need to answer those questions? What kind of resources do you have? A lot of it's budget driven. So pretty much everything Kezia and, Stephen, everybody talked about is to follow those steps. And I think it's great that through these workshops, you've gotten some really concrete manuals on how to walk through those steps. I don't know if that's helpful or not, but
It
building.
is. I think what I really appreciated that you said in there is, you can chunk the work out. You don't have to take on everything at one time. I think states need to understand, like, just get started somewhere. And, it doesn't really cost anything in this virtual world we live in to bring people together, right? It costs intentionality and energy and listening skills, but it doesn't cost money per se. So, even that part of that data collection piece and getting perspectives on the table, that's what we can do sometimes when we don't have money for building out robust data collection systems. So, I think those are really important points. Thanks for sharing that.
Yeah, if I could just share one little story. So IMPART Alliance actually started more than 10 years ago. And our first step was to bring people together, contacted all these key people that we thought would, have influence and skills and talent, brought them together, and I explained to them what we wanted to do. We wanted to do this integrated model and fix the direct care worker shortage, and this big grandiose idea, and people looked at me like I was asking for world peace, and I said, this is doable. We can do this. And to your point, Serena, we have to break it down, one step at a time. One step at a time. And we all call ourselves now the tortoise, and it's based on the children's fable about the tortoise and the hare. And we remind ourselves, everybody on the team has a little tortoise on their computer to remind them that, step by step, one step at a time, just keep moving forward. And in the end, the tortoise wins the race. So get yourself a tortoise to remind
That's
you.
exactly right. That's so helpful. I think one other piece is sort of the framing and messaging around all of this, and in the context of tightened budgets and fewer resources, it becomes more important than ever to make sure that where you're allocating your resources makes sense and is generating the most bang for the buck. And so to be able to communicate that really effectively, to kind of bring these different partners on board, I think is really important. And then, I mean, it all kind of comes back to getting the right partners into the conversation, as Claire was articulating so well, because also then it allows you to be sure that you're connecting the dots between efforts that are already underway. So there's less duplication, more coordination, all of those kind of pieces that are all about working more efficiently and effectively as well. So engage partners, engage partners, engage partners.
Absolutely.
Stephen or Julie, would you add anything?
I was going to add something that you said at the very end of your comment here, Kezia, and that is basically just start somewhere. Start with a concrete question. Look at what you already have. Look at the data sources that you already have, because every state has something or has access to something, and build on that. Don't get overwhelmed by the complexity of the issue, because it is very complex, but try to be as concrete in your thinking as possible. And that will really, I think, at least it helps me with the logic and really nailing down the next steps to make things build on that.
Mm-hmm.
Yeah, Julie.
Yeah.
Go ahead,
Sorry,
Claire.
go ahead. I was just going to say, it does help to start small with something really doable, so that you have some success stories right away, so that gives people hope, that, oh, geez, we do have some power here. We can get some stuff done. So, the low-hanging fruit, start with that, and just create some hope and success stories that you can build on. Sorry, Stephen, I didn't mean to cut you off.
No, not at all. I appreciate that comment. I also, I think this sort of theme that's coming through strongly is this like emphasis on what can we do incrementally, what's more feasible in this context, even if it's not that kind of like, you know, huge solution that's very resource intensive. Like I almost think of lean years as like the kind of housekeeping years. It's not the year when you like add on to the house with some big new addition. It's the year when you're really focused on improving what you have. And Julie, what came to mind for me definitely was just like really getting to know your data sources and like, is there one domain of one data source where you can move the needle, so that lean years are temporary too. We all know that. Like there are years where there are more resources and less, and I think taking the time to make incremental progress on data collection is going to pay off such huge dividends down the line when the resources are there to make the kind of bigger changes, bigger reforms, bigger policy changes.
I guess I would add to that, though, I agree completely. Break it down, the tortoise one step at a time, but at the same time, don't lose sight of the long-term goals that you want to get to, because sometimes people get bogged down into those little incremental steps, like we got it, and they think we finished B and C, and they forget about, XYZ down the road that where we're really trying to go. So I try to on a regular basis bring people back to, why are we doing this? Why is this important? Where are we trying to get to? And yeah, we're doing really well with this one step, but so let's finish this one step, but then there's another step, and then another step, and another step, right? Because so it's really this dance between keeping your eye on the long-term vision, reminding people of it, and these incremental steps that you have to take in order to get there.
That is beautiful. I think that's a perfect note to wrap on, actually, is holding the vision and then working toward it one step at a time. So if we could share the slides again one more time, please. We have our contact details here. So please do not hesitate to reach out, follow up with us with questions, comments, concerns. We're happy to continue the conversation. And then we will be sharing an evaluation survey with you all. And this is the first series like this that the Strategy Center has organized and led. And so your feedback really does matter for helping ensure that these series going forward are as valuable as they can be. So I believe that there will be a link in the chat. Certainly there will be a follow-up inviting you to complete the evaluation survey. And then on the next slide, I think it just encourages you to go to the Strategy Center website to see all of the resources that are available and sign up for other updates and events. And with that, I want to personally thank you all for attending and participating in this workshop series. It's been a joy to be part of the process with you all. And I think I can speak on behalf of my co-presenters, co-leads in expressing those thanks. And then I want to hand it over to Nicole, the director of the Strategy Center, to just close us out with a few final words. If you're available, Nicole, thank you.
I am. Kezia, thank you. I have to be honest, I think that really Claire said it best, which is start where you are. We all are working towards the same collective outcome. And it just strikes me that as we are lifting up the need for person-centered model of care, you really are, everyone is working towards, person-centered models of training, and there's such commonality across our work. I leave the series very inspired and looking forward to our next series, which we will take place later this spring and this summer. So please stay tuned for more details. I want to thank all of our partners who contributed to the series, all of our speakers who are part of it, and of course, all of you who took the time to attend. You will be seeing follow-up emails that's related to the tools, and we look forward to continuing our learning process with you. With that, I say have a wonderful